It's a great pleasure to be part of the expert forum for producers and users of disaster-related statistics. My name is Virginia Murray. I'm the head of Global Disaster Risk Reduction for Public Health England and chair of the Technical Working Group for UNDRR and the International Science Council on the hazard definition and classification review, and I have a great pleasure in presenting it to you. As you know, the Sendai Framework has been really critical in the delivery of us understanding what data we need to be able to understand the impact of disasters. And most importantly, we have this very important message about preventing new and existing disaster risks, but to prevent and reduce hazard exposure and vulnerability to disasters and all the related hazards. The all hazards message comes out very strongly in paragraph 24J of the whole Sendai Framework, where it calls for the strengthening of technical and scientific capacity to assess disaster risks, vulnerability and exposure. Understanding what a hazard is something that went to the open-ended intergovernmental expert working group, which adopted a whole series of guidance on indicators and terminology in November 2016 and was formally adopted by the UN General Assembly in February 2017. In it was a definition for hazards: a process, phenomenon, or human activity that may cause loss of life, injury, or other health impacts, property damage, social and economic disruption, or environmental degradation. A very impressive definition, but with the annotations that come in with it, very complicated for many of our wonderful UN member states' offices of national statistics to interpret more clearly, to be able to report more accurately. Here I show you some of the multi-hazards and the biological hazards information, but if you look at the environmental, geological, hydrometeorological and technological hazards, you will see that the shopping list is lengthy. In order to report effectively for the Sendai Framework Monitor, which was agreed at the Sendai Framework process in 2015, it was very clear that this monitoring process had to be a very effective way of trying to understand what the problems were. And the issues about the all hazards really came up very strongly in 2018. And in 2019, I was asked to try and take forward a process as the chair of a technical working group to try and pull together what we mean by hazard definitions and classifications. So looking at the all hazard paradigm, it became apparent that we needed many. So we've had huge representation from UNDRR with wonderful UN agencies, including the World Meteorological Organization, the World Health Organization, and of course, UNECE and many others. Through the International Science Council, we've had science partners from IRDR, CoData, GEO, and many others, but we've also had the Insurance Development Forum representing the industrial science partners. And with the international humanitarian organizations being represented by the International Federation of the Red Cross, Red Crescent, we had an incredibly rich technical working group, and I'll show you more about them later. But it wasn't just them. We had incredible numbers of volunteers who came involved, and then we were able to reach out to many, many more with surveys and other systems. The whole purpose was to have a process to take that definition from the UN General Assembly agreement on it, to look at all the different hazards we could find, be they lists that came from the science domain or from the UN domain, reviewing the IRDR glossary of 2014, considering how it works with the Sendai Framework monitors already, and then pulling this together with expert consultation and discussion, agreeing a process by which we looked at inclusion criteria to come up with our list of hazards. I'll explain the rest later. So our hazards included hydrometeorological ones, floods, obviously, and many others, but also extraterrestrial ones. We had a lot of support for geohazard ones, but interestingly enough, no parent inside the UN organizations to help us to deliver those. So we've turned very much towards our science colleagues. Environmental hazards, of course, are really massive, and the wildfires, sea level rise, and all these other issues have become increasingly important and possibly hard to define some of the time. But I was very pleased as a medical professional that we were able to include biological hazards, which hadn't really been included in the hazards domain before. So we've included biological hazards for humans, plants, and animals. We've also included chemical hazards, which I think are very important as a toxicologist. And of course, they're the technological hazards, which are so important. They range from explosions, obviously, to waste disposal, to how we manage transport accidents, dam failures, and other things. A new set of hazards, which are not part of the Sendai Framework, were also included. And this is just to make sure that we had a much more consistent information on these hazards. And they included the societal hazards, such as civil unrest and financial shock. Of these hazards, there were 302 that were finally selected, although there was a huge amount of discussion and debate about what should be included. And this is the first tranche of trying to understand what we mean by these hazards. Each hazard now will have a hazard information profile with a primary definition linking to the highest level UN authority or science authority that we can possibly have to try and explain what the hazard is, and hopefully to fit very closely with what the statistical offices will need. An expanded scientific definition was thought to be needed to try and explain it more clearly, and where we have globally agreed metrics and numerical limits or defined guidelines, these have been included. We've also included drivers for hazards, outcomes for hazards, but also risk management to try and illustrate the point more clearly. And finally, for each of these, we have an ownership of the definition wherever we can. And obviously, we have detailed information on the name of the contributors to hazard definitions and dates. Everything wherever we can has been referenced, so we have a source, preferably an open source, to make sure that it's as clearly available as possible. We have a set of recommendations. We know this is not finished. It will need regular review and update, and we need your engagement to help to deliver this. For example, we need to facilitate the development of multi-hazard information systems. We need also to understand how we can get greater alignment and consistency of these hazard definitions, both in each individual country, but also where we can possibly compare and make better information available. We need to make sure this hazard data actively engages policy makers and scientists in evidence-based national risk assessment processes, disaster risk reduction, and risk-informed sustainable development, and other actions aimed at managing risks of emergencies and disasters. We need to conduct further research. There's no scientist who wouldn't say that, but we are still learning all the time, and COVID-19 is a clear example of how we've had to learn very fast. And finally, we need to address cascading and complex hazards and risks, which has been demonstrated by the impact of the pandemic of COVID-19, not just on the health impacts, but also on the economic and many other impacts that have been identified. So I just wanted to show you very briefly who on the technical working group have contributed most. I as chair, have been very lucky, but I wanted to reflect my good friend Michael. And Michael Nagy has been so key in taking forward this expert forum, and I thank him enormously. But there are so many others, as you can see on this list, that have been absolutely essential. Inside the group that we've been working particularly with co-facilitators, I want to thank the incredible support from the International Science Council and from the UN Office for Disaster Risk Reduction, particularly Anne-Sophie Stevens and Irina Zodro. But I have on the list my good friend Kanza Ahmed, who's come in to help work with me in Public Health England as a consultant, taking forward some of the epidemiological and statistical data that we know we now need to improve. There's been a huge collection of others, including those who've reviewed the technical report, but these are the list of the people who've been involved in the hazard information profiles and indeed in the review process. So it's been a real global effort, and I thank all for their commitment. Why does it matter? Because in 2015, the United Nations adopted 3 landmark agreements: the Sendai Framework for Disaster Risk Reduction, the Sustainable Development Goals for Agenda 2030, and the Paris Agreement for Climate Change. The whole purpose of this review and technical report is that it should support all 3 by providing a common set of hazard definitions for monitoring and reviewing implementation that calls for a data revolution, rigorous accountability mechanisms, and renewed global partnerships. And of course, you who work in this world of statistical data will know that the Sendai Framework and the SDGs have very similar reporting goals, so we don't want to add to your burdens, but we want to make them clearer in how they can be used better together. So what do we do next? Well, I wanted to share with you a proposed way forward. UNECE, and again, thanks to Michael, is currently suggesting a statistical review and pilot of this review. In part, it is to determine the usefulness of the definitions for statistical reporting, in particular to understanding how we get greater alignment and how we can implement, how we can engage actively with policymakers. So we have a proposal to set up a series of small pilots to assess opportunities and challenges, and volunteers, of course, are welcome. Thank you.